And at Houston Healthcare, COVID-19 hospitalizations are also approaching an all-time high after bottoming out just a month ago. Zach Merchant is live outside the hospital now to explain.
Frank, over the last 4 weeks, the number of people hospitalized with COVID-19 here at Houston Healthcare has grown more than 500%, throwing all of the healthcare workers just inside those walls right back into the thick of the fight against this virus.
Right now, we're about where we were during the surge of the first wave.
As of their latest report, Houston Healthcare now has 37 patients hospitalized with COVID-19. 4 weeks ago, there were fewer than 5 patients. Dr. Dan Stewart, the hospital's chief medical officer, says the ICU is now at capacity.
Our ICU and ICA are both full right now.
About 10 of the 32 total ICU beds there have COVID-19 patients. Non-COVID patients, who Stewart says may have delayed seeking medical care during the earlier peak of the pandemic, fill up the others.
The patients that are coming to us now with other illnesses tend to be sicker and are needing hospitalization.
General inpatient beds are feeling the same pinch.
We're full right now. We are at capacity. We're on code surge, which means we're trying to get as many people out of the hospital as we can that could possibly be discharged home. And we've got people waiting in the emergency room to be admitted who are pretty sick. So we're busy right now.
Stewart said this number of patients is unusual, but not unheard of. He did not rule out the possibility of diverting patients to another hospital, but said if you need help, Houston Healthcare doctors will still likely be able to treat you on site.
We have to scramble trying to find you a bed or whatever, and we do have some patients in holding areas, but right now we do this all the time.
But obviously, a drop in patient numbers would help. And Stewart says the simplest steps, like wearing a mask, social distancing, and avoiding places like bars and clubs, could go a long way toward giving healthcare workers time to treat those who are sick.
I liken it to, other things that are risk for us, okay? Driving in a car is a big risk for all of us. We know the risk involved, but we exercise caution. We buckle up when we get in our cars and try to drive the speed limit or stay close to it.
So is there any silver lining there? Well, maybe. Dr. Stewart, as well as some other physicians we've spoken with in recent days, say over the last few months, doctors have developed better treatment programs for this virus that they say they hope will help reduce the number of fatalities and help people who do have to be hospitalized have shorter stays in the hospital. However, it's impossible to say at this point if that is actually going to be the case. The next 1 to 2 weeks could be telling. And of course, we're going to be keeping a very close eye on it as the calendar moves forward. Live in Warner Robins, Zach Merchant, 13 WMAZ News.
Thank you very much, Zach. Coliseum Health System tells us they have also seen a recent spike in virus-related hospitalizations. Navicent Health has consistently declined to say how many COVID-19 patients they are currently treating.